This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
Greetings to all and welcome to our sixth episode of Sailing Through Menopause. In our previous episode, I talked about how to prevent a fall in elderly. We have seen how to make our home elderly friendly as we make it child friendly for our kids. Today, I'll be speaking about how to prevent osteoporosis and improve bone health. I must admit, it is one of my favorite topics on menopause. Welcome all. So let's start our discussion on bone health and osteoporosis prevention. Let me first speak about why discussing osteoporosis and bone health is so important. Osteoporosis is a silent killer. Approximately 1 in 2 women over ages 50 will break a bone because of osteoporosis. It makes bones weak, so they break more easily. Most people don't realize they have osteoporosis until a fracture happens, as there are usually no signs or symptoms. Menopausal women are at high risk for osteoporosis. Let's see why bone health is so important. It is because healthier your bones, the more active you can be. Our bones give shape to our body. They support our body weight. They protect soft organs. They help in movement. They help in storage of minerals and fats, mainly calcium and phosphate, and they also help in red cell formation. So what actually is a bone? Most of us think that bone is a dead tissue because we can't see it grow or feel anything about it. Bone is actually a living tissue from which substances are constantly being removed and replaced. Healthy bone is strong and it does not break easily. We can't feel what is happening inside our bones, yet throughout our life, cells are continually updating the microscopic framework that keeps our bones healthy. Like a never-ending reconstruction project, old bone is continuously broken down and replaced daily with new bone. So whatever is required in our diet for having a healthy bone formation is a must. Let's see a life cycle of a bone. During childhood, adolescence, and early adulthood, large amounts of calcium and other substances are added to the bone, strengthening the skeleton as it develops. Bone acts as a reserve for calcium in the body. Now, from birth to the age of 25, our bodies produce more new bone than they break down, increasing bone density. There's something called as peak bone mass, that is when our bones are strongest. It usually occurs between the age of 20 to 30 years, as you can see in this graph. In the females, the peak bone mass is lower than in males. And after a certain age, like around 50, the peak bone mass tends to fall due to menopause. So from around age 25 to 50, bone density tends to stay stable with an equal amount of bone production and bone breakdown. After the age 50, bone breakdown becomes faster than bone production. That is, more bone cells in our body are destroyed than they are being formed, and bone loss often accelerates. Factors such as hormonal changes or deficiency of calcium or vitamin D in a diet can cause a decline in bone mineral density, leading to osteoporosis. So why do we need to achieve a good peak bone mass? Now, if we have a good peak bone mass, it will help in reducing the risk of osteoporosis later in our life. This is because bones are strong before bone loss begins. Peak bone mass can be increased by ensuring that the diet contains adequate amounts of vitamin D and calcium during childhood, adolescence, as well as in early adulthood, and by regular activity, especially weight-bearing activities such as brisk walking, running, dancing, and climbing stairs in which the bones bear body weight. So now coming to our topic of osteoporosis. What is osteoporosis? Now osteoporosis, or we also call it as porous bones, is a chronic disease of the bones. The inside of a healthy bone has small spaces like a honeycomb. Osteoporosis causes these spaces to grow larger. As you can see in this diagram, during osteoporosis, you can see large holes in the bones. When bones have more open spaces inside them, they lose strength and density. The outside of the bone also becomes weaker and thinner. Patients with osteoporosis have bones that break down quicker than they can be rebuilt. So the deterioration of bone tissue leads to increased risk of broken bones known as fragility fractures. People with osteoporosis can suffer a fragility fracture while doing routine activities such as just standing or walking. Osteoporosis most commonly affects your ribs, hips, and bones in your wrists and spine. So does osteoporosis has any symptoms, or can we feel anything before having a fracture? Now, most of the cases of osteoporosis may not have any symptoms in the early stage. We will only come to know that we were suffering from osteoporosis after we have a fracture on a minor fall. But there are signs of the disease gradually having weakened your bones if we are careful about it. There might be a loss of height over time because your spine has tiny fractures. There's usually unnoticed and painless. As I said, we can have broken bones. You can have low back pain. A fractured bones in the low back can cause severe pain, usually lasting for a week. You'll have a hunched posture, that is, you will not be standing straight and you can be bending forward. So if you have any of these symptoms, it is better that you see a doctor or go for a DEXA scan. What is a DEXA scan? A DEXA scan is a bone density scan, which can be performed by any physician or a technician, and it will let you know what is the condition of your bone if you're suffering from osteopenia or osteoporosis. Osteopenia is a stage of weakened bones just before osteoporosis. So who are the women who are at high risk of osteoporosis? We have certain modifiable and non-modifiable risk factors for osteoporosis. The modifiable ones are the ones which you can prevent by taking care of them leading to osteoporosis. One of them is smoking. If you have a low body weight, if you have low calcium intake, low sun exposure, alcohol abuse, if you have history of amenorrhea, that is a premature ovarian insufficiency, or if you have early menopause, estrogen deficiency, repeated falls, and a sedentary lifestyle. So all these factors, if you take care of, you can prevent osteoporosis later in your age. Non-modifiable risk factors are older age, Asian race, history of fractures as an adult, family history of osteoporosis, history of amenorrhea, that is failure to menstruate in women with no recognizable cause. There's no cure for osteoporosis, but there are many things you can do at all ages in your life to help prevent and treat osteoporosis. It is vital to understand the risk factors and causes associated with this condition. So we can prevent osteoporosis by stop smoking, increase calcium and vitamin D in our diet, having proper medication, weight-bearing exercise, prevention of wrist fall, and reducing alcohol in our diets. So as said earlier, we can take care of osteoporosis at all ages in our life. During childhood and adolescence, make sure that your diet is good and you are exercising regularly for having a maximum peak bone mass strength. During early to mid-adulthood, maintain or increase bone density, improve muscle mass and strength. During post-menopause, maintain bone strength by slowing the rate of bone loss, improve your muscle mass and strength by balance, and reduce wrist falls. During older adults without osteoporosis, maintain bone strength, increase muscle strength, balance and coordination to help reduce fall risk. Older adults with osteoporosis or history of fracture, again, you can improve your bone strength, muscle strength, balance and posture to prevent falls and reduce risk of further fractures. Increase confidence and independence. So the most important factor in preventing osteoporosis is your diet. Diet is an important factor in forming healthy bones. An adequate calcium intake at all stages of life, coupled with an active lifestyle, helps to ensure that bones are as strong as possible. It is particularly important during childhood, adolescence, and early adulthood when bones are developing. Follow food pyramid for balanced nutrition with adequate amounts of fruits, vegetables, and cereals to be had. Calcium deficiencies in young people can account for a significant difference in peak bone mass and can increase the risk of hip fracture later in life. So as we have discussed, calcium and vitamin D are essential for preventing osteoporosis. An adequate intake of calcium is important throughout our life. Dairy products such as milk, yogurt, and cheese are all sources of calcium. Pulses, nuts, dried fruits, and green vegetables such as spinach provide calcium, as does fish, which is eaten with the bones such as canned sardines. Here's a list of calcium-rich foods and how much calcium will be available per serving. So the richest source of calcium are low-fat yogurt, milk, cheese, and pudding. The proteins which are rich in calcium are tofu and almonds, vegetables like kale and broccoli. Other foods like dried figs and fortified foods are also rich in calcium. Now, vitamin D assists in the absorption of calcium from food. Some vitamin D is required from the diet, but for most people, the major source is through synthesis in skin that is exposed to sunlight. As well as being important for the bone health, good vitamin D status is a factor in the prevention of falls among older people. A deficiency of vitamin D over a long period of time causes rickets in children and osteomalacia in adults. The other factors which can help prevent osteoporosis are maintain healthy body weight and do physical exercise. Maintaining a healthy body weight appropriate for your age and height helps support bones. The best activities for your bones are weight bearing and resistance exercises, which we have already discussed in detail in our previous video. Weight bearing exercises such as walking, hiking, jogging, climbing stairs, playing tennis, and dancing force you to work against gravity. Resistance exercises include lifting weights and using weight machines. We should say no to drinking and smoking. Smoking worsens the negative impact on peak bone mass and puts older smokers at additional risk for bone loss and fractures. High consumption of alcohol has a similar adverse effect on the skeletal health. The other important factor which prevents osteoporosis is having a normal hemoglobin. In our country, anemia is very common. Iron deficiency anemia leads to more of bone resorption than bone formation, leading to again weaker bones. So, a healthy diet rich in iron, calcium, vitamin D, potassium, as well as phosphorus is a must for preventing osteoporosis. So now to summarize our topic, osteoporosis is a serious but silent disease due to decreased bone formation or increased bone destruction. Early prevention is the key element to prevent fracture. Diet and exercise is the cornerstone for osteoporosis prevention and treatment. Screen with bone density sooner if any of the risk factors discussed earlier are present. Treatment is effective in decreasing fracture risk. So thank you for your patient hearing. I hope this helps prevent osteoporosis in elderly. Our next topic in the series will be diabetes and thyroid disorders in menopause. Thank you.